My name is Megan Olino, and I'm 15 years old, and this past April I was diagnosed with Hodgkin's lymphoma.
One of the hardest things that we do is to tell patients that they have a diagnosis that's pretty serious.
Right when I got to Phoenix Children's, they were very nice. It made me feel a lot safer. I felt a lot better being here than at the other hospital.
Every child who's diagnosed with cancer gets their own social worker. They get a full team of a social worker, a nurse clinician, and then attending.
The patient and the family are the biggest part of the team. Without them telling us what their needs are, we can't serve them correctly. I make sure that they understand they're the captain and the coach of the team.
Once we're introduced to the family, we're usually there from the beginning, right? When we tell them about the diagnosis, we help them with employment issues and obtaining FMLA and working with siblings and just making sure that the family understands what's going on and putting resources in place for them.
It never crossed my mind. Throughout my whole life, I never thought that I could ever have cancer. And when it really did happen to me, I realized how lucky I really am and how thankful I really am for everything.
So we are a growing department, allowing our children to have very well-balanced care from all different aspects of their treatment here at the Cancer Center.
Each program has people who are focused on that particular disease who are also networking around the country with similar hematologists and oncologists who focus on those diseases.
In addition to our involvement with the Children's Oncology Group, we have an active phase 1 trials where we're allowing our patients that would otherwise not have an opportunity to have experimental therapy to come to our center to have chances to cure their cancer.
The most common kind of pediatric leukemia at this point, the cure rate is between 90 and 95%. That's taking it from a death sentence in the early 60s. Research is an incredibly important component to all of our care.
In the new expansion, we're going to have an entire 7th floor so that there'll be private rooms, there'll be more bone marrow transplant rooms, more isolation rooms, a day hospital for longer hours of infusion, more examining rooms. Will be in closer proximity to the lab and to radiology and to other vital things that we utilize. It will be not only an improvement in our care, but also much better to patients and their families.
In the East Valley, we're opening up lots of opportunities to see patients closer to their house. We want to keep care as close to the family so that they don't have to drive as far. We're able to do chemotherapy, transfusions, scans, initial consultations. We have just about everything out there.
The fact that we have this as a program that we can offer families really is wonderful because it allows families to stay as intact as possible, to stay in their community, to get the support that they need from their community, to continue their jobs, to continue having the other children go to school and attend school and to be with their friends. So it's been an invaluable resource for the community.
Through this whole thing, the scariest part for me was probably having to lose my hair. But as a girl, it's kind of a big thing. But now, my hair is growing back, slowly. But it started to go back now, and I'm thankful. Very glad.
We want the child to be cured of their disease and to fulfill their life at the best of their ability. And trying to give the comprehensive care is the most important.